Hey everybody, it's Dr. Mary Gardner with Lap of Love Veterinary Hospice, and today I have a special guest with me, Lorraine from Dogtopia. Welcome.
Thank you. It's wonderful to be here, and I'm excited about our topic today.
I know. So Lorraine, you reached out to me maybe 2 months ago or something like that for maybe a little bit of advice from my perspective of boarding senior and geriatric dogs at your facilities. And then we just started chatting about this. And, you know, I've always had a struggle myself finding boarding facilities that I can trust with my dogs, period. But then with my older dogs, because they've got a lot of times mobility issues, or maybe they're on some medications, or they've got cognitive dysfunction, or they're just fragile, right? And so I've always had a bit of a struggle. And I also have one of my dogs is a bit aggressive. So let's not go there. But Sam, my girl Sam, last year, she had really bad issues. And I didn't go anywhere for a year, which, you know, thankfully because of the pandemic, I couldn't. But that allowed me to stay home with her. But otherwise, it's very difficult for me to travel. And I know that a lot of those who are watching are in the same pickle. It's you've got an older dog, and I'm sorry, I just can't trust anybody. And so a lot of times we postpone trips, and sometimes we have work trips that we can't get out of, and we have to do them. So I thought this was a great topic to have, and I'm really excited for everybody. And those who are popping on, let us know where you're from. So let's get started, because I want to talk about many things on ways that we could safely board our pets, maybe some do's and don'ts, some things to ask your boarding facility if there's not a Dogtopia near there. But let's start out with you guys. So tell me, what's Dogtopia?
Oh, well, thank you. So Dogtopia is the leading daycare and boarding provider in North America. So we are pretty special, award-winning franchise, and it's an opportunity, a place for pet parents to be able to enroll their pets in daycare, very similar to how our children go to daycare, in the sense that they're in a safe environment, that we have some really pretty important differentiators between ourselves and, you know, some of the independents out there. So some of those things that make us a little different is our highly trained staff. We do have canine coaches in the playroom, completely supervised play, but our canine coaches go through extensive training. And their training has been recognized by the International Association of Animal Behavior Consultants, as well as the Certification Council for Professional Dog Trainers. So what's pretty cool about that is that our staff can go through different phases of their career and have accreditation already. And that means that, you know, they're in the playrooms, they're learning to speak dog, if you will. You know, dogs are really amazing communicators, and they really do talk to each other and to us. But it's important to learn what that language is. So that's one part of why Dogtopia is a little different. Obviously, I'm a big proponent of safe, supervised play. So our playrooms are really safe. I focus on that. That's my main role at Dogtopia. We have climate-controlled playrooms. We also use a rubber flooring in there for safe play.
That's very important. That's so good for our mobility dogs.
Exactly.
Okay, so continue, because I have so many questions about this.
Feel free to interrupt. Yeah, so another big part of what we do is planned play and planned activities, because as we know, dogs really need to have that exercise and that activity and to stay mobile as they get older. So, you know, I read a statistic that, maybe you can correct me if you think I'm a little off, but somewhere around 50% of dogs might be obese in the United States. And certainly with the pandemic and the corona pounds that maybe a couple of us, I'm guilty of, put on a little bit at home, our dogs have done the same thing. Yeah. So the opportunity for dogs to go to daycare and to stay active, you know, they burn tons more calories just by moving, just by being there with their friends. So that's a really big part of daycare and some of the benefits. And also, finding their best friend for life, their BFFF is what we call it at Dogtopia. Dogs are super social, and they really do find their friends, their friend groups. They make friends.
Really? Like, Like a playground.
Totally. Yeah. And we know who's friends with who's, and we often reach out to that pet parent and say, hey, are you coming on Thursday? Because I have Scruffy in, and Scruffy really loves to play with your dog. So it's really funny.
Oh, so cute. So, first off, the name Dogtopia sounds like where I'd like to go with my dogs one day at the end. Like, so many people ask me, do I believe in heaven? And I'm like, well, I think it's Dogtopia. So you guys have a great name. Now, you know what I forgot when I started this, it's not just overnight boarding, but daycare, which I have to tell you, Lorraine, is so important, not only for the mobility and weight loss and things like that, but cognitively, there's 50% of dogs over the age of 10 have some level of, like Alzheimer's for dogs, and they need that interaction. And especially with a lot of people going back to work, it can be, a little bit stressful for them. And so if they could have that. So now let me ask you, you said that you deal with the safety. What's your role?
So I have a really unique role. And actually, I think I have the most gratifying role at Dogtopia Support Office. I really love what I do. I get to focus on the health and safety of the dogs in our care. I mean, just last week alone, we saw over 70,000 dogs come through our doors in all of our locations. We have 166 open and operating daycares. That also board, but we focus a lot on the daycare benefits. So my role, I previously was a veterinarian hospital manager. I coordinated the AHA certification process. So you understand very detailed and super important certification that veterinarians can have in order to be accredited, meaning they're following all the best practices for health and safety, and they're taking it very seriously. So then I was an environmental scientist, and I focused on the best practices for the health of the environment as well as people. So I take those two things together, and I focus on infectious disease control and keeping Dogtopia to be like the cleanest in the industry, right? You don't want to walk in and have any kind of odor. And I'm focused a lot of my time on keeping it clean.
That is actually pretty fun. I love that. And right, for those that don't know what AHA is, you're right. It is the best, gold standards that hospitals can follow. So it's fantastic that you're bringing that into the daycare industry, or that concept. Now you said 167 locations.
Yeah, well, but by the end of this week, it could be 167. We're opening just about one a week. We've got quite a few more planned for the end of this year, as well as next year already in the pipeline. So that means we're in 35 states, and we're in 5 different territories in Canada as well.
Canada too. Oh, you're almost. We're in 32 or 3 states, but only in the United States. So I'm on your website on another screen over here. So somebody can go to your website, hit find location, put in their zip code or postal code, which is super easy, right? So I can. So that's nice. Let's see if there's one near me.
Okay, yeah. Tell me which one you're close to.
Let's see if I'm close to anybody here. Let me see. Oh, wait. Of course, this is on the spot, on the fly. So Fort Lauderdale is closest to me, which makes sense because it's way down there by the airport. So nice. And so that was super easy for people to find. So you were at least in Florida, which is fantastic. We have a lot of Florida friends here. Okay, so let's talk about boarding a senior pet or daycare of a senior pet. Hands down, the majority of our dogs that we see do have some kind of mobility issues. So I like that you said the rubber floors, which is great. What about like rough housing and do we have a little fragile area for our little eggs?
Well, I think it's really important to look at the definition first of what do we call a senior? What does a senior dog really mean to you?
Oh boy, you're after my own heart.
What is the language we're talking here? So senior for us just means that you've reached a certain age, and that can be different depending upon the breed and size and all of that as an individual. So there's a lot of variability because of the differences of the breeds, from a huge Great Dane all the way down to your teeny tiniest teacup Chihuahua. That senior age can be different. However, senior doesn't necessarily mean fragility For us, senior just means it's time to really focus on wellness. It's time to focus on quality of life and preserving that quality of life for a longer time, as long as possible.
Yeah.
Now, geriatric for us really kind of defines that fragility, where we're really worried a little bit more about weakness, poor balance, loss of muscle mass, and a decrease in that cognitive function, like you're mentioning.
You guys are my dream space, because that's what I preach all the time. It's the geriatrics, which are so different. These are our fragile. The frailty happens.
Right. And so seniors for us is wonderful. We'll take seniors all day long. That just means congratulations. You know, AARP has sent you something in the mail. No more driving in late, maybe. That's
by the way, I got AARP and I haven't even hit 50 yet. So they're marketing down. Okay, so geriatric. So let's say I come with my 14-year-old girl, Sam. She was a big girl too. So she was geriatric. So what would be kind of the intake process or questions that they would be asking?
Perfect. So if you were really needing to board a place, there's a couple things. I've got 5 on my list. So if I get too long-winded, feel free to interrupt me. Okay. But the first thing is really socialization. And if you're looking for a place that's open play, you know, you have to really think about what that's like for that senior geriatric dog. Mm-hmm. Is that something they're used to? Is that something they can handle? Have they been able to go through what we call our meet and greet process? So that's sort of the interview. Where we are evaluating that dog for safe open play and daycare. So our boarding facility is going to also be incorporated into our daycare that's open play. So is that something they can even tolerate and, you know, thrive in that situation? So going through that evaluation process is important. A part of that evaluation process, we actually require what we call the 3 plays before a stay. So that just means we want to see your dog come in and have daycare with us at least 3 times. Now, that's because, you know, it doesn't matter if they're having the time of their life. It's going to be new and exciting, and there's that dump of adrenaline. There is that new kind of maybe a little bit of stress that happens because it's so different. And so the 3 plays before a stay helps that pup sort of learn that we're fun, that mom and dad come home and you get picked up. You're not being abandoned. You know, you're not here forever, that you get to have fun and go home so they don't get worried. That really helps with that adjustment period if a dog is new to daycare but needs to board. So that's one. What do you think about that? Good.
I love the 3 3 plays before the stay. And I think it is so important because I remember one of my boarding facilities here, it was just like they met my dog, like the humans met my dogs, and that was it. And I'm like, okay, but they're very different playing and or staying, and it was just okay. But I went to another place near me before that one, and I was actually really nervous because of their policies, and something that also made me nervous is my one dog who I said is aggressive, right? So his name is Norin, and he only liked my girl Sam because Sam was like a, you know, the Eeyore. I always say, okay, you can, you know. So she never riled him up. He can't get riled up or else he's going to get aggressive. And so I said, listen, he needs to board here. Only him and Sam can play, nobody else. And so like the people who took them definitely looked like they just graduated high school. And they said, well, we will test him on other dogs. And I said, no, you don't need to test him on anyone. I'm telling you, he can't ever have friends. And they said, oh, we'll test him on a medium dog. And I'm like, well, I would hate to know if Sam was a tester, you know, like for this. So it just made me so nervous. So I really like to see that before they stay for a week, it's okay. And so people should plan to do this probably a month or 2 before the schedule.
Absolutely.
Right? Yeah.
Because also needing to make sure you're current on those vaccinations before you come. And we always like to see some time between the vaccination and the stay. So that lets their body develop that immune response and make sure that they're going to have a good response to those vaccines before they play. So that's one part, absolutely. Another thing, like you're mentioning, is the separation between size and temperament, right?
Yes.
You have different playrooms associated with their size and their temperament. So that allows the grumpy sort of older police officer who's, you know, that golden retriever who's just going to make sure all the other pups are in line. You know, we have those personalities. And then you also want to make sure that they're not being bombarded with puppy energy all the time, because that reduces the tolerance, and then that creates situations where it's less safe in that playroom as escalation energy kind of develops. So these are important questions. So socialization, do you separate by size and temperament, or is this always just a big open free flow? That's one thing to know. Another thing is nap time. So is your senior going to be able to rest? Because we know babies need a lot of sleep. Dogs in general need a lot more sleep than humans, but of course, as they get older into the senior geriatric time frame, they actually need more, right?
Right. No, they do. And too much is too much. We need little bits of energy usage. So that's actually really important. You don't want them overwhelmed, because they're going to feel worse the next day. It's there so many things. So that's awesome. So is it a couple of hours a day in the playrooms, and then have a little.
At Dogtopia takes a 2-hour nap in the midday. And this is something a lot of independents might say, oh, we don't believe in that. We're crate free, we're cage free, and dogs will rest when they want to. And sometimes that's true, but the forced sort of nap time allows for us to do a deep clean sanitation in that playroom. So we do it midday, and then we do it at the end of the day, which is really important to me and to us, in terms of infectious disease control and cleanliness. But that nap time is an opportunity to reset the energy. But also our seniors can have additional space and nap time as well. That just gets, like you're saying, I want to make sure that their immune system doesn't have a drop from not getting enough rest or kind of special me time.
Right.
And then we run into other concerns if their immune system's a little stressed out.
They need to introvert also every now and then. So that I could use a nap time. And I used to get that when I remember nap time when I was a kid in like kindergarten or something like that. So that's super important. Oh, I have my friend from Mexico City is on the line. Fun. All right. So that was, I think, 2. You said you had 5 things.
So I do. Yeah, that was actually 3. So I think we've got socialization, separation, time. So now we've got medication tracking and Dogtopia or dog meal plan at Dogtopia. So medication tracking means that we will make sure that however many medications or supplements your dog comes with, we can administer on time, as long as it's during, our hours of someone there being there. But also, and the one thing we don't do is we don't do injectable medication. Okay. So
I was going to ask that. I was going to let you finish this, because if there's usually it's diabetic animals, so they should not. Okay, so not injectable, but pills.
Yes, we absolutely can do that. And of course, there's so many reasons why injectables are a little bit more difficult for a dog boarding facility. But and that would probably be better suited at medical boarding at something like a veterinarian. So we will also make sure your senior has got their specific food. Now, I think it's really important that you bring what they're used to, because we don't really recommend a dietary change for anyone. We will always have a high quality in-house food. That's very important to us. But keeping your dog on their food is ideal. So we make all those customizations for dogs while we're with us, and make sure that's part of the plan wherever you need to board a senior dog. And then lastly is comforts from home. So we welcome people to bring in their special bedding. We do ask that it's small enough to fit, if you have a large dog, that it's something that we can wash if we need to, or have a removable cover. That's very nice because we do want to make sure things get home clean. But we think it's important that dogs have those comforts, that sense of home with them, and that helps kind of let them rest and enjoy their stay.
So that's good to know, because there are a lot of boarding facilities that say bring them, and all they do is put them in a garbage bag with the name of the pet on them and stick them in storage until they're picked up again. So it's,
I didn't even.
Oh yeah, they do that. So, and it's sad because there's been studies, Lorraine, that say it was a few years ago. What they did is they took a number of dogs. I think I mentioned this in one of my other videos, where they trained them to sit still through a CT scan. And so they put them in the CT machine and they presented them different smells. One was of their owner, one was of a dog they knew, one was of a dog they didn't know, and one was like a cat or something like that. And the smell that triggered their happy centers of their brain was their owner, was the number one.
That's so sweet. I mean, I can just dog feeling comforted with that. That's nice.
Yes. I mean, we all have something where we're like, that we smell and we're like, oh, they do the same thing. And so that smell was their number one smell. Their number two smell that lit their pleasure zone was a dog they knew. So they're little friends, right? So that was, how nice is that? So I always suggest, if your pet is being boarded or going in for a surgery for the day or something like that, bring a shirt with them, leave it in the cage, so that way the kitty cat can lay on it or something like that. So, so I think that's fantastic that you guys encourage that, because it will help, the community there if there's more relaxed and happy dogs.
Absolutely.
Yeah. So, and it's great to also bring, I can't stress enough, I would definitely have my own foods there. And I usually like Ziploc them into like Monday, Tuesday. Is that good to do?
Absolutely. We definitely prefer that. The more communication and the more labeling that's done before you arrive is so much easier for our team, especially during busy boarding seasons. And yes.
Good. Because I'm a little obsessive, and I make all my little packs up and stuff like that. So I'm trying to think here about how long has been your longest person to board there, or dog to board there? Do you have any
We've actually had, a couple stories where we become the pet. Might have a situation where the pet parent is no longer able to care for that dog. It's very rare. I think it's only happened once or twice. But we have had a long-term boarding dog become a family member of Dogtopia, which was actually a good thing in the long run. But in general, the longer boarding time frames are usually, most of the time it's a long holiday weekend. During the summer, we'll get a week or two. Some of our East Coast locations really, and even the West Coast, I shouldn't say that, it's just one side or the other. We service a lot of military families and government employees and things, and even hospital workers response that really needed our care during that time, where their dogs felt happy to be with us, happy to be with their friends. Our canine coaches develop a very strong personal relationship and a really emotional relationship with the dogs in their care. So that was just really heartwarming for us to be able to support some of those essential workers during this last year and this ongoing process we're still in. So we have had a couple long term, but in general, that's not really the worst thing.
Usually, and I've got some pictures to show. This is my favorite one to show of a little guy. But what is going on? Oh, look, I'm the worst at this. Hold on, let me hide this one. What's going on here with the bubbles?
Yeah, so that's part of our planned activities. And actually, those are bacon bubbles. They smell like bacon. Yeah, it's wonderful. The dogs think it is the best thing ever. And of course, it's just a fun activity that we have. I have peanut butter, bacon, so it's a fun activity.
I had no idea there's bubbles that smell like bacon.
Yeah.
I need to write these down. Oh my gosh. That is just amazing. And look at this little guy. Look at this little squirt here. Oh, I love it. They're so cute. Now, little gray muzzle. And then one more that Could be older, could be young. I don't know, because these guys look a little old when they're young too.
Right.
Now, something that I struggle with, which I don't know if I like or dislike, because when I boarded some of my pets in facilities where they have cameras to watch, I sometimes am like, oh, look at them sleeping or not sleeping or play. Like, so sometimes I have to not look myself because I start to guilt myself that they're sleeping, but they're just sleeping, right? So can the owners live stream in or see pictures or videos?
I'm glad you asked that. I'm a big believer in that open transparency. So pet
Totally.
parents should be able to see what's going on. That's probably something to look for if you do need to board your dog. There are times where we turn it off for nap time because that's when we're in there cleaning, and that we put on some calming music and turn the lights down and we go in and clean the room quietly. But that's a small portion. It doesn't take very long for us to go through that process while they're napping. But the webcams are very important. It's funny, we did some analytics on our data and could see that our pet parents log in and watch for a long period of time.
This is what I mean. Like, I'm obsessed with watching. So I think they're fantastic though to have, so that way you just, you're not concerned or something like that. But, there were some times where I was like, oh, my girl, she's, sitting there, and then I would not be on my vacation. So as long as it keeps comfort and not take you away from your vacation, I think that's wonderful.
Yeah.
Now, if there's not a Dogtopia near them and they need to find a daycare or boarding facility, I would love to talk to about what are some of the points to look for. And you've already mentioned actually two actually more than two, but one is that you want a longer period of time between vaccination and boarding. And I just want to encourage that. And I don't know if you recognize that you said that, because so many people will get their dog vaccinated 2 days before they're boarding. It's doing nothing really. It's not enough. And your dog may be a carrier because they aren't and then they spread it around. So I think that's fantastic that you want them to have it done before.
Right. We have a policy of 48 hours at a minimum, but I really prefer 10 days. Even 2 weeks is ideal. So
2 weeks is ideal.
Because it's really important. I think that you have some prolonged immunity, and who knows for certain, with certain dogs, and there's a very individual immune response to vaccines, but you probably have some coverage if it's an older dog that's had a good history of vaccination. But certainly we're always looking for good ways to help us control canine cough and the upper respiratory infections.
Yeah.
But as long as we have dogs playing together and we have asymptomatic dogs who could be carriers of it, we might always have the common doggy cold that gets passed around daycare. But
and when you're older, it could be a little bit worse, So just like us older humans, we don't want them to get a flu. Same thing. So
right.
What else can you recommend our friends here if they're looking for a boarding facility? Like some telltale signs of either great or
I'm a big believer in using all your senses. You walk in and you get a sense, and intuitively as well. Listen to your messages. But I think that, using your sense of nose and sense of smell, what does the facility look like? How well are they communicating with you? And how knowledgeable is their team on common canine things, whether it's a health concern or behavior abilities to understand, how dogs interact with each other. And then how good are they going to be at responding to you if you have questions and any concerns? Do you have an emergency contact? I think that's one of our biggest challenges in boarding and that's on the pet parent side, not necessarily on the boarding facility, but do they even ask for an emergency contact? We really, as a boarding facility and daycare place, want to make sure that if there's a reason for your dog that needs to go home, because we're not veterinarians, we're not a medical facility. Do you have someone who's responsible that would be willing to come pick up? That's a real big part of what I'd like to make sure, pet parents do, but also facilities.
That's a tricky one, Lorraine, because let's say I don't have friends and I wanted to go on vacation, right? What if my dog, to move them to another, like a veterinary clinic, I'd have to arrange a little doggy taxi.
Yes. Well, we actually will provide the transportation, but which is fine. But the real question is, have you talked to your vet hospital? Will they accept your dog in your absence? What is that veterinarian client and patient relationship like, right? And how does Dogtopia fit in the middle of that? So when you board with us, you fill out the enrollment form and you're signing an agreement that we have the ability in your absence to care for your dog, especially in case of an emergency. And so sometimes I still find that veterinarians question that, or maybe unless they get a credit card from mom and dad aren't going to provide care. But so we're always willing to work with that vet. But if you don't have an emergency contact who's responsible, then we do ask that you help us arrange that veterinarian contact.
That's important. And, sadly, I think everybody's heard me say this statistic way too many times, but 50% of pets have not been to their regular veterinarian in their last year of life. And so it's really sad. So especially before you're going somewhere, have them fully checked out, because there could be some underlying problems that we didn't even know about, and things can happen all of a sudden. Has nothing to do with the place they're at. Things can happen, but it's really good to make sure that there isn't anything underlying that would also maybe not be a good idea to board. And I know that you and I were talking about heart failure, and somebody had asked about this. And this one now there's heart disease and there's heart failure. So if your dog has a type of heart disease, so my Doberman, he had dilated cardiomyopathy, so big floppy heart. And when he was not in heart failure, I would have been comfortable him boarding somewhere, playing or whatever, and getting his pills that he needed throughout the day. But once his sickness got to a point where his respiration was challenged, so he was breathing harder, any time of those, I personally would discourage as a veterinarian that they're boarded at like an open play facility or somewhere where there's not 24/7 watching. And so any respiratory distress, if your dog has laryngeal paralysis, I would probably discourage that, or end stage heart disease, or metastasis of cancer or something like that. And best then to find a good veterinary hospital that can provide, like you said, the medical boarding, because we don't want them worked up. Like, they need to be calm and restful, and somebody can really watch how they're breathing and doing. So that, I think, is really important.
Absolutely. Well, my main reason for reaching out to you a couple months ago, and it was such a joy to find you, and it was such a wonderful resource for us to get really educated on the senior dog and the stages leading to geriatric stages. But we put together, with your help and your inspiration, the Senior Dog Questionnaire. So this is a tool for our locations to be able to ask those questions about mobility, vision loss, hearing loss, muscle, reduction, that kind of thing, cognitive ability, social ability, but underlying health concerns. And
right.
A scoring process so that we can kind of assess whether or not your dog is sort of reaching that point where we're too far into the geriatric stages for safe boarding. So then you have to look at other alternatives, whether that's in-home care or with your veterinarian.
Yes. And not to say that's why I like you guys, but it shows your integrity. It shows that you care. The fact that you actually reached out and asked me for some advice. I've never had any other daycare or boarding facility ever do that. And I wish they would, because these guys are little fragile eggs. And when Duncan, my Doberman, with his heart failure, I had to always have them in home care. And I found a wonderful pet sitter. Lean on Jean is her Facebook page. And I now fly her. I've flown her when I moved into my town to watch my animals, because it was actually cheaper, because I had so many medications and everything else, that I'm like, oh, and then she could water my plants too while she was at it. But But I think the fact that you guys actually consider this is telling, and it's important. Yeah.
And your collaboration, it was really wonderful.
Oh, no, I love it. Now, what about, just a quick question on, what if they come with harnesses or like the halos, if they've got vision loss, you let them keep them on?
Not necessarily. So in open play, what I'm always a little worried about is the attractive nuisance. And we do have, so if there's other things like that that need to happen, we might have to reconsider or look at whether or not maybe staying in our suite is appropriate or finding an alternative. So we do prefer that dogs have, if they're brachycephalic breeds, a harness on, or a Dogtopia collar, because we do use collars in the playroom to help us with redirection and collar desensitization and training. But when it comes to other contraptions and things like that, we're a little hesitant, but it's always something that I'm willing to look at and address.
Well, I think you make a very good point. Like the halos for the vision, I could see another dog be like, "Rah!" and running off with it. So that's actually a really good idea. And I was just looking at daycare, boarding, spa. So they mine always got bathed before they came home, because I don't know what they were playing in and causing havoc. And this is awesome. So 35 states, you said?
Yeah, so far 35 states and lots of locations. I've been with the company going on close to 6 years now. So when I started, there was only about 28 locations, and we've really just understood the pet services industry now. It's just grown leaps and bounds. It's continuing to be big, but and partly, like we were talking about the AHA certification process, we've created our own certification for the entire industry called Top Dog. So Top Dog walk through a very similar process that you would go through to become an AHA certified veterinarian. It's going to be the best practices, the gold standard in dog daycare. So yeah, we're in lots of locations, and we continue to be in more and more. It's keeping me very busy.
Well, I love that idea, the little Top Dog. So just a few people that have written in. Constance said before her girl passed away, she was at the office like right before, and she can't imagine not bringing her back. I agree, Constance. But so many people, either it's hard to get them in because they're, big, they've got mobility issues or anxious or something like that. So no judgment. That's when I say try to find a mobile veterinarian that can come and help you. Hi, Danny from New Jersey. And then Lynn says there's no Dogtopia near her, but is there another place you could recommend or almost like the Top Dog certification or something like that, where they can, like, what should they look for trust? Now, you said that your people are certified or your process is certified by the training association. That's a good one.
That's true. So you can always reach out to them for a good connection in your neighborhood. I'm really curious, Lynn, where you are, because I might be able to find out if we're building one nearby.
Lynn, you got to put in your zip code.
Look, I'm not so good at memorizing zip codes, but certainly city.
No, I've got it up over here. I'll look. Oh, but it's coming.
Perfect. Thank you. But of course, I think that reaching out to your veterinarian is a good idea. I think that would be my first step if I didn't have a Dogtopia nearby, because I know when I was a vet tech and an office manager, I either did it on the side myself for our special clients, or I knew people who did, who were very well qualified to look for health concerns. And, of course, we could do things like insulin injections if we needed to. So that would probably be my first step. Florida, is that East Coast?
That's north of Tampa, Newport Richey, if I'm not mistaken, right, Lynn? I think that's Newport Richey's on west side.
Not a lot in Florida, so maybe not in great driving area for.
Right, maybe that's it. Even our Fort Lauderdale's a little south for me. I'd like one in Palm Beach, but listen, you actually gave a better answer than I did. I never. Right, your veterinarian may have an option. When I worked in general practice, our boarding wasn't fantastic. It was what it was. It was runs. It was, I started before I became a vet. I worked in the kennel. So it was, 4 walks a day, quick to pee or poop, come in, like that was it. So it might be your only option, and that's nothing wrong with that. But I really like the, interaction and things like that, or the cages are small. These are vet hospitals that don't have the the large facilities or the outside areas. So they may be able to recommend one. But you brought up a very good point that there might be technicians when in their area that will be available to do that. And I've had many technicians, when I lecture, they all come up to me and they say, I want to get into hospice. What can I do? And I said, the first thing is to look into doing this on your own and respite care, in-home sitting and things like that, because it can be so much more helpful to families. And then Tammy said she was able to work from home when it was Zeus's time, which that was with me with my girl Sam. It's the only good thing about the last year was that I was home with her. All right. So Lorraine, what did I forget to ask you? Because we covered a lot: socialization, medications, things from home.
My favorite subject.
I know this is my favorite subject as well. And I really appreciate that you guys reached out to get some advice, that you care enough about our old guys. 30% of dogs are in their double digits, which is a lot of them. So, and they're the ones that kind of need the little TLC, the extra bits. So I think that's amazing. All right, if there was any other questions, anybody can pop them in there, and I'll answer them if we've got any. So sorry, how many places in Canada did you say? Because we do have some people watching in Canada.
East Coast and West Coast. So we've got Toronto, we've got, all the way over on the other side as well.
Okay, good. I have some good friends in Toronto, so I will definitely let them know about this as well. All right. Well, if there's any other questions, I'll answer them throughout the week. But I just want to say thank you so much again, Lorraine. This has been so much fun. And a little different topic, but I think very important. And you know what? The holidays are going to be here before we know it. And places like yours get booked up also.
Yes. Thank you for mentioning that, because it's always hard when we get those last minute requests, because we never want to turn away, especially our longtime daycare dogs that need to board. We want those reservations early, and we want to make sure you've had time to go to your vet and make sure you're updated and all that. So plan ahead. You're right.
It's so true. So Thanksgiving is, and even now, everybody's probably going to go somewhere this year. So, so definitely think about that in advance. All right. Well, thank you again. And thank you for all that are watching, and love up on your green muzzles for me. Till next time. Bye, guys.